Welcome to part 2 of the audiocast, The Need for Patient Optimization in Joint Replacement Patients. My name is Bruno Capella. I'm a Managing Senior Director at Accelera Health Partners, and joining me today is Sue Miller, Senior Director at Accelera Health Partners. One of the things that Accelera Health Partners here too is we've spent a considerable amount of time defining a pre-optimization process plan and the tools that a hospital could use to implement their own optimization model, right? The right model for the right hospital. Knowing that there's a lot of moving parts to that, and it's pretty, it's somewhat of could be a complex project to start. Where would the best place for them to start this process be?
Again, another good point. It is complicated and complex when you have a number of different perspectives that you're trying to create a unified vision for. So I think a good first place to start is taking a really good, hard, honest look at your current processes and how they are impacting the overall care and experience for both your patients and your surgeons. Look at the data and understand what it's telling you. What is your length of stay and what is the impact of clinical complications on that length of stay? Look at things like your predicted versus your actual complications and understand if you are accurately capturing those issues that are present on admission. Talk with your surgeons and anesthesiologists to understand their concerns and what their experience has been with your current processes. You'll also want to have an understanding and talk with your primary care physicians. Understand what their role has been and whether that has been a satisfying role or not and how that process could be better for them. You'll want to look for common concerns and common issues and solutions that you could potentially implement. Then you'll figure out what model will work best for your particular market. Sometimes you will be looking to add responsibilities to a current resource that's available in your systems. Other times you'll be looking for a new resource. Generally, what we find is that community hospitals will not have a large enough surgical volume to really require a full-time FTE that's dedicated solely to the pre-optimization care. When you think about what some of the big dogs, the Mayo clinics and the Cleveland clinics are doing, certainly their surgical volumes warrant that dedicated resource and facility. But again, that's not typically what you'll see in a community setting. But if you are looking to do or add a new resource, you'll need to have a job description in place. So again, this is a good news, bad news type of situation where you have a number of different models that you can implement, and sometimes that can work for you or against you. So a good rule of thumb is having a good planning process up front and creating that vision with all of your key stakeholders.
Oftentimes when we're working with leadership of the hospital and the surgeons, right, results matter, right, number one. And Accelera has implemented this optimization model in a number of different hospitals over the years. And I know you are currently working with a number of different hospitals and you worked with some hospitals in the past. Share with us a little bit about from a results perspective.
Yeah, you're right. It all certainly does come down to results. The good news is this is a process that will absolutely yield very real and very impactful results. In one hospital that I've worked with that has completed this initiative, they have seen a real reduction in serious complications. We're talking about cutting their respiratory, renal, cardiac complications in half, and in some instances, nearly eliminating those types of complications. That can result in shorter lengths of stay and certainly happier patients. From a nurse perspective, the nurses are better prepared for patients when they arrive on the unit because those pre-existing issues are proactively communicated with a plan for post-operative care. And most importantly, I think the best information is what's been shared from patients. They are able to speak to having an improved experience, and they certainly can recognize that the hospital has a plan and process in place specifically for them, so they feel supported and empowered and can really be a very active participant in their own care.
So, okay, we've implemented a optimization model at our hospital. We've made changes to the structure, right, of how the patients are flowing through. We're identifying their risk and making sure that we're being proactive in making them ready for surgery. we make improvements and we see the improvements you just talked about. We see realized savings in terms of reduced complications and better length of stay. And then a year later, we slip backwards. How do you sustain a model like this at a hospital?
Yes, sustaining a model is oftentimes, the real challenge, and this really will take focus. First, it's good planning up front. Once you understand your market, you understand all of your challenges, establish clear metrics and expectations for your program. Utilize the guidelines and algorithms, make sure that they are evidence-based, and the metrics tie specifically to those different guidelines. I think early in the process, you'll really need to monitor compliance and consistency. We know that change can be a difficult thing, and frequently when you initiate change, there's hiccups in the process. So be prepared for that. Have a plan for how things will be handled if there is a problem. I think the first time a surgeon hears news from the optimization resource that they need to delay a surgery, expect pushback. So it's smart to have a plan up front to deal with that. And then really making sure that you're keeping all of your various key stakeholders in the loop. Be transparent with your results. Be open to changing processes if you see that the results are not yielding the types of outcomes you want. Your best recipe for success is really success and good metrics. The old saying, success breeds success. So keep communication lines open and stay focused on the process.
Well, thank you, Sue. I think the key point in your last discussion point there was the results, right? So we know from Accelero's experience that implementing an optimization model, right, will yield results that's right for the patient and it's right for the program. You did share with us some of the challenges in terms of navigating the course, in having the right people at the table and the right model. And finally, you really talked about, taking a complex process and really the best way to start that process. So this concludes today's discussion on the need for patient optimization in joint replacement patients. If you have any additional questions regarding this topic or others, please reach out to your local Zimmer sales team member, and they can facilitate a discussion with Sue or another member of the Accelero team. You can also reach us at our website at www.accelerohealth.com, and then go to the Contact Us section. And thank you for your interest in Accelero Health Partners.